I'd also like to provide everyone an update on a recent shipment of a drug called remdesivir that the state of Maine just received. This past Saturday, Maine CDC was officially notified that the state, as well as a number of other states, would be receiving a shipment of, in our case, 10 cases of a drug called remdesivir. You might have heard about this drug. A recent study conducted by the National Institute of Health showed that it had the potential to benefit patients who were suffering from COVID-19, especially those who were severely ill. The 10 cases that Maine CDC was slated to receive would be enough to treat approximately 50 patients. Yesterday evening, the United States Department of Health and Human Services informed Maine CDC that the shipment of drugs for Maine would be arriving to our warehouse this morning. This morning at about 11 a.m., it did arrive, and within 1 hour, it was placed on transport vehicles for distribution to hospitals across the state. In fact, just as we were walking in, we heard that at least one of those hospital systems had already received their shipment of this drug. This is a situation where time is of the essence. We know from hearing from physicians across the state that there are critically ill patients in ICUs across the state that physicians would like to start using this drug on. That's why we were prepared to receive the drug, put it on the transport vehicles, and ship it out as soon as we received it. As a result of this quick action, doctors in Maine hospitals today have a new tool in order to treat patients who are critically ill and suffering from the most severe symptoms of COVID-19. I'd like to thank all of our staff who were involved in receiving the shipment, loading it, and transporting it, as well as to healthcare providers in Maine who now have this additional tool to use.